Hi, my name is Judy, and I am 3 days, actually almost 4 days, post-op from ACDF C6-C7 neck fusion, as you can see in the front of the scar. The purpose that I wanted to make this small video, I did research just like you probably are on YouTube for information on the surgery, predominantly because I wanted to find information about the surgery in reference to obesity. And the majority or all of the sites that I found have dealt with normal size individuals, so their situation was different from mine. This is not the first time I've had this surgery. I've had 2 areas in the upper part of my neck operated on about 11 years ago. There was nothing to it. I did fine. Left hardly no scar because they do it on the natural crease that you have on your neck. At that time, because technology was different than it is now, I wore a bone growth stimulator and did a lengthy physical therapy. This time around, 11 years have gone by. I had also, at that time, had bilateral carpal tunnel surgery. And what was happening over the last few years was my hands were going numb again, and I would sit and rub, trying to get the feeling back into my fingers and hands, to the point that I was making blisters on my fingers and scarring them. Also, one of the biggest things was neck pain. I started having a lot of neck pain. When I turned my head from side to side, it sounded like little gravels rubbing together. The doctor referred to those, he called them little Krispies, like Rice Krispies. And there were times when I turned my head to the right that my neck would pop real loud, and it gave you that real quick fright scare that, oh gosh, it's going to stick and hang and it's not going to turn back normal. The pain predominantly just got worse and worse. I was taking Tylenol, any of the over-the-counter medication I could find, and doing a lot of complaints about headaches every single day. The headaches would come on and they would be just extreme, but by the time I would get maybe across the room to go take medication for it, the headaches would go away. So it was a real inconvenience. It caused me a lot of pain, especially at work. People really didn't know what was going on because I didn't really share a lot of that information. They just didn't realize how miserable I was. Nonetheless, as you can tell, I am a large person. Anytime you have to do surgery, you have to hear all the precautionary measures and all the could be's and might be's that might happen. I have, over the last several years, had problems with doing any kind of outpatient procedures with anesthesia because it's hard for them to keep me asleep. When I've had colonoscopies and things done, I've actually woken up on the table before. But whenever I go into the hospital setting, they've been able to keep me asleep. This time around, today is Friday. Just a few days ago on Tuesday, I entered the hospital early in the morning. We decided this time around technology had changed. It's going to be easier, faster, quicker. A 1-inch incision, go in, some new device. It was going to be so much better and quicker. However, because of my size, it did not work out that way. The 1-inch incision and the apparatus they put in, it did not work because the utensils, the screwdrivers, the tools that the surgeon uses, does not reach in, did not reach to fit to do the surgery. So we had to do plan B, which was the use of a cage. And apparently, according to the surgeon, they had the same problem with the cage. So the third thing that we ended up doing was some type of a plastic, a polymer, that was a spacer was put in place, and then cadaver bone in the middle of that, and then a hinge, if you will, that's made out of plastic. During the procedure, they intubated me. I guess I was probably trying to wake up during the procedure. I don't know what happened, but I bit through the tube, or tried to bite through the intubation tube, so they had to intubate me twice. Also in recovery, my pulse ox dropped down in the 80s, so they ended up putting me on oxygen, and I was on oxygen when I was taken back to my room. So it turned out to be a longer, harder procedure than what we had anticipated. The surgeon said that he did not care to do any other surgery on me unless I had a lap band procedure, and I respect and understand that, because I would be a nightmare for any anesthesiologist or surgeon. However, large people do have health problems, and large people do have to have procedures, so that's kind of where I am with this. Throat gets real dry. I was taking, they actually gave me morphine injections in the hospital. I also was given Soma, which is a muscle relaxant, hydrocodone. They took me off of the shots so that I would be able to go back home the next day. I spent the night next day, and I'd up and walking around, excuse me, really chewing on crushed ice worked the best, drinking water constantly, trying to keep my throat lubricated. The pain, it's not so much isolated to the fact that you've had your throat cut and all this, but just as of having a surgery where they've got you in different positions, you don't know how they had you on the table, sore in spots the next couple of days that I couldn't really explain. A lot of soreness across the upper portion of my back. Actually, just taking Tylenol here at home, I can stay up about 2 hours at a time, and I get really fatigued, really tired. You just got to lay down. Your head feels like it's 100 pounds. You've just got to lay down to get some relief from it. And the ultimate thing, too, that I've complained about, it's really hard to swallow. It feels like something is just choking you in there. But other than that, it is a relief in the arm pain, the headache, the hand numbness is gone. And I can actually turn my head and not hear that little grinding sounds that sounded like gravels grinding together. But if you are an obese person like myself, there are times when you have to have surgeries, and it's something that you have to weigh the risk of. I don't regret having it. I hate that it was a hard situation on the surgeon and the anesthesiologist. They saw me whenever I went to the doctor's office and went to the hospital, so seeing how large I was shouldn't have been a surprise. But anyway, I did have the surgery. It had to be done, and I hope to have a fast recovery because I need to get back to work pretty soon. But if you are contemplating the surgery, research, read up, know everything that's going on, all the terminologies, and I wish you the best. Godspeed.